Whoa! Ah! My leg! I need to see a nurse.
How to be successful in the nursing discourse community. Although there are many different types of nurses, they all have one main goal within the community. This goal is to treat and care for patients. Nurses work to help others and interact with families, making sure they are cared for at a time of need. They share a set of values that often are provided through holistic care in relation to a patient's cultural and social need. Nurses also play a role in providing patient education in order for the patient to fully understand any information given. A nurse never stops learning. They continue to further their education due to the constant changes and advancement in healthcare.
Did you page me?
Yeah, the patient in 2B has a sprained tibia. So what course of treatment should we follow?
I think we should go with rice.
Okay, cool. Well, Peter, you have a sprained tibia. So you are going to need to practice rice. Rest, ice, compression, and elevation. And you should be healed within a couple weeks or so, okay?
Okay.
Communication.
Nurses communicate on a constant basis, usually through face-to-face interactions. For example, a nurse could inform doctors of any complications or discomfort a patient may have. Technology also plays a role in the communication aspect of the nursing discourse community. Charting is now done through computers, which makes access to information instantaneous. Nurses also can communicate with one another through pages, cellular devices, and radios. It is great to know that nurses can always contact one another or other faculty, like physicians, instantaneously in whatever situation may occur. These useful tools of communication help increase the efficiency and reduce the amount of errors made while on duty. Nurses can also provide information and feedback through journals. Journals provide information such as how to perform a procedure better. The American Journal of Nursing is a popular place where nurses within the discourse community publish their work. The contemporary major topics include nursing shortages, expansion of job opportunities outside of the hospital, advancements of tools, and the collaboration with more healthcare providers to ensure the best care for patients. All right, Peter, I'm going to be taking your blood pressure. The nursing discourse community use terms to better explain and classify what information they are trying to share. Nurses use terms like BP for blood pressure. Medical terminology has a vast set of vocabulary that is universal among the medical community. A type of genre this community partakes in is charting. Patient charts are electronically documented. This type of documentation contains the procedures that were conducted towards the patient. Care plans are another genre of the nursing discourse community. Nurses use them to define the problem, find solutions, and determine the success rates of the solutions. Are you comfortable?
Yes.
To become one with the nursing discourse community, you must receive a Bachelor's of Science in Nursing. Nurses are then administered a license by graduating from a nursing program and passing the National Council Licensure examination. From there, nurses can specialize in certain areas by obtaining proper certification in that subject. Nurses can also advance in practice by becoming nurse practitioners or nurse anesthetists, which often require a master's degree. Clinical experience is required in all levels of nursing.
Development.
Healthcare is in a constant state of advancement due to the everlasting growth of technology. Technology will continue to advance, which will force nursing professionals to advance as well. Nurses live a career filled with a continuity of education and training. They must always be up to the current techniques to treat their patients with the best possible course of treatment. The advancements in nursing is changing the way that nurses practice, from the way they deliver care to how they manage clinical workflows.